COVID-19 booster shots to start for seniors this month. Immunocompromised people will also receive a third jab as Singapore prepares to live with the coronavirus. No easing of restrictions for now as authorities monitor the situation amid a spike in COVID-19 cases. For more, infectious diseases expert Dr Leong Hoe Nam joins us. Dr Leong, a rise in community cases, but there's no loosening or tightening of restrictions despite calls from both sides. What's your take on this stance?
To be fair, both sides are actually very valid, and they are good points on both sides, and none are wrong. None are wrong. But if you think about it, we shouldn't be looking at the total numbers, but instead we should be looking at the number of patients that are in the ICU and needs oxygen, because that is the burden which a hospital has. And if the hospital cannot cope, the entire Singapore structure will collapse. So thinking back, we should be looking at the numbers that need ICU as well as need oxygen. And if you look at the numbers, about 5 in ICU and 27 require oxygen, we have quite a bit of headroom. We can do about 5 times more, but of course, I don't want to see those numbers. Get people vaccinated so as to move them from the severe cases to mild cases, and Singapore will be fine. So at this point in time, I think it's still okay to open up.
Dr. Leong, there have been no new variants reported on the island, but the MTF says that the focus now has to shift from those numbers. But how worried should we be with this rising number of unlinked cases that we're seeing?
Unlinked cases, very, very important. If you think of an iceberg, you do not know what is beneath the sea level. And that exactly is the unlinked. The unlinked cases represent the unseen part of the iceberg. And there are many cases, what we call the known unknowns. We know it's a problem, but we don't know what's the severity of it. Now, what can we do about the known unknowns, about these unlinked cases? It goes down to contact tracing. Can we do a better job in contact tracing? And all of us have been diligently doing our trace together. Why can't we do it better? The answer is because the Delta strain is really very transmissible. In a matter of 10 to 15 seconds, the virus is transmissible. If the contact tracing team try to lower down the threshold, then we will end up quarantining too many people. And this will paralyze the country. Think about it. Go to your Trace Together app. You have about 1,000 contacts every day. And there are about 150 new cases of COVID. And if you try to lock down 1,000 of these 150, it's 150,000 people quarantined every day. Multiply that for 14 days, the period which you need to quarantine, we have easily 1 to 2 million people we should quarantine every 1 to 2 weeks. That's ridiculous. We can't cope with this, which means that unlinked cases has to be like this. And all of us have to work together for the social good of Singapore, for the betterment of Singapore.
And judging by the current spread then, how soon and critical are booster shots for the wider community, aside from the prioritized groups?
If you look at the science of it all, the prioritized groups, the more than 60 years old, will benefit. There's scientific data for it. We're seeing it coming from Israel. We have the immunocompromised hosts. They are benefiting from it because their immunity, their immune response will be better. And if you look at the people who are dying from COVID-19, it is the elderly and those who are immunocompromised. So they are really the high priority. But if you look at the others who are less than 60 years old, they do very well with just 2 doses of vaccines. And you look at the FDA's approach to it, they scrutinize all the data and they don't have good data to go for the 3rd dose. Now, if you you're fortunate enough to belong to the less than 60 years old, then number one, don't worry because your immunity is good enough so far and has shown consistently all our patients have been admitted. Whether you need a 3rd booster dose or not, wait for the signs to show up and then we'll decide. But more importantly, Singapore, get your act together, vaccinate those at greatest at risk.
Dr. Leong, it was said today by the task force that continued testing, we have to make it a way of life. But how aggressive can we really go with mass testing? And how practical is it going to be for the longer term? I mean, we don't mass test for the flu, as an example.
That's a great question. I'm going to call this the holy grail of testing. The holy grail of testing is that everyone will have the rapid antigen test kit at home And before you go out to work, before you go out to school, you do an antigen test kit at home. And when you're negative, you are then safe to go out to the community, and you know that you won't spread the virus to anybody. I call that the holy grail because it is really going to be difficult to get everyone to swap in. But I'm going to hang the carrot without the stick. And the carrot is we give an inch to gain a foot. An inch, a swab into the nose, you enter into the nose about an inch, but you get a foot into the door to keep the door ajar by a foot so that the economy can come in, so that the movements of goods, cash, money comes in. And for us Singaporeans, we get a breath of fresh air through the door that's kept ajar by the foot. So Singaporeans, I'm asking you, or rather the government is asking you, sacrifice that 1 inch to get their foot in return. And the economy and the breath of fresh air will come.
Thank you so much, Dr. Leong, infectious diseases expert and metaphor expert as well, Dr. Leong Hoe Nam.